Okay, so doctor, I just wanted to know, are there any certain days of the cycle where the patient has to come for consultation? If yes, or if there are not any certain days, like certain days of the cycle, they have to come for consultation. Are there any certain days there?
Yeah, we generally call such patient on the day one or day two or day three of their treatment, right? And that is the time where we can judge the what is the enteral follicle count, that is AFC, that how many, what is the tendency of the patient when we are not giving her any kind of hormonal support. What is the condition and how many follicles naturally her body is recruiting. That is the AFC count. And that we generally see on day one, day two, or day three. Either of the day they can come. And also the quality of endometrium, right? These are the things. So we always ask our patient to come on day one, day two, day three. And that is the time where we can perform the hormone by LHFSH, that kind of ratio.
Right. Hi, doctor.
Hi.
This is Sakshi. I wanted to know one thing, doctor, regarding what time this AMH test or FSH test can be done during the whole month. Which time you will get the best possibilities or detail about it, that when a person is fertile or not. This will give a idea, and which month day we can use these tests.
Right. Thank you, Sakshi, for a wonderful question, because many patients always confuse about what kind of hormone is meant for both undergo for test. For AFC and AMH, there is no certain criteria meant for both. Right? You can check it anytime. AFC is something, and the LH FSH profile is something which you have to perform on day-to-day basis. So when the patient is confused when to do what test, so we generally categorize or define them a particular day, which is day one, day two, or day three of the period. And in those days, all the tests, all the hormonal test can be performed without any confusion. So if we ask our patient, you go for AHC test and AMH test of any of days of the month, and then you have to go for or the LHFH on the day 2, day 3. Patient get so much confused because she don't know why we are saying and why we are so particular about these tests. So unnecessary, just not to create any chaos or confusion in their mind, we can simply ask them to go for all such kind of tests on the day 2 or day 3 of their periods. That's the simplest way to make your patients comfortable.
One question. We often get the cases where the female patients complain of AMH level being 0. So are there chances that the IVF can be a success in such cases?
No. If the AMH is generally how we categorize, if the AMH is less than 1, that there is a very poor ovarian reserve. That's a kind of marker for the ovarian AMH. Right. And if it is less than 1, then definitely it's going to be very, very hard. And in this, many of the patients having difficulty in producing the eggs, and also we might get some few follicles, but we may not get any oocyte on the day of open pickup. Right. But since not many patient, and also it depends upon age, if the patient is of less than 30 age and the AMH is 0, we are saying, or less than 1, then we can have a repeat of AMH also, right? Sometimes AMH values are not correctly done or something. We can always repeat in such scenario where the condition is such that 0 or less than 1.
And doctor, if AMH level is less than 1, are there ways we can improve the egg quality and the birth can increase naturally?
So if the AMH value is less than 1, there's a very, very little chances of getting pregnant on their own. It's very, very difficult, right? And there is no such medicines, I feel. Yeah, there are so many medicines available, flooded in the market, that you can improve the quality and the count, but they generally don't work And again, there's a much role of age factor. If the patient is young, you have little bit time to do some kind of experiment to see how is the growth, right? But if the patient is of advanced age, then giving any kind of such hope, I think it would be waste of her precious time. So in that case, what we are doing, we are treating a patient who has less than 1 AMH, like 0.7, 0.8, right? So we are trying for their natural eggs, and in those things, we have to give them, more number of LH and FSH hormones, more units of hormones, and sometimes we may get 2, 3, 4 eggs. We are actually doing it very often because we are exposing with lot of low NH patient, right? And there's always probability of 50-50. We might get good quality embryo, then may not also get good quality embryo. This is the scenario. So if you ask me clearly, if the patient have a really poor less than 1 image, we can give them one try if she is really keen for her own eggs. Otherwise, what is advisable to go for the donor oocyte. That is the more workable situation.
Okay, doctor.
And ma'am, how do you decide that how many cycles can be done in a patient for IVF? Because the patients are very much anxious about the cost also, that they can't undergo it repetitively. But still, if it's not a success.
Right. So globally, IVF success rate is about right? Self IVF success rate is about 30 to 35%. This is not in India, this is globally, right? And what I feel is that any patient must undergo 2 to 3 cycles of IVF if they are really very, very, serious about these things. Because when you have such a low percentage of success, right, then you can't simply say that I will just try once. If not so, then I will try again, and then so at least 2 to 3 cycles one should undergo for the IVF.
And one more query, ma'am. Like generally we get queries from small town patients and all. So they are planning for the treatment in metro cities. So they have one query that for how long duration they'll have to stay in the city because they have to plan it accordingly. It's gonna cost them for that purpose as well. So do they have to stay for the entire process in the city, or they can go back to their hometowns? What generally?
Okay. So yeah. So one previous month where I am saying pre-workup. So pre-workup means they can come for 2 or 3 visits. They can pay 2-3 visits, and they can go home, right? But during the treatment, like when we decide that this is April, and April is a month where you are doing the pre-workup, then patient can come in twice or thrice depending upon the scenario. And now April ke baad what it comes? May. So if the May is the month when we are going to do the ovum pickup, in that day continuously patient have to have in that city, right? Because every day we ask them for a particular time of the injection, because all these injections have a kind of short half-life, so we have to be very specific about the time. If 12 or 9 a.m. is the time, then patient has to come every day on 9 till 10 day or 12 day, whatever is the number of days they are going to have the injections. And after the pickup has done, they have to again stay there for around 6 to 7 days to understand whether they are going for this cycle embryo transfer, if everything is all right clinically from our side. And if not, they can move ahead and get the information about their embryo quality, and we will freeze all the embryos, and then they can go home. So if you ask me number of days, it is around 15 to 18 days on that month when we are planning to do the pickup and IVF. Yeah.
Thank you.
Ma'am, just want to understand that हमने बात की कि पेशेंट की क्वेरी क्या आई, पेशेंट से हमने बात की, उनकी रिपोर्ट्स हमने ली, वी शेयर इट विद यू। आपने इन केस आपने सजेस्ट किया कि इनको ये वाला टेस्ट करा के आना चाहिए, देन क्रेडी हेल्थ पीपल विल आस्क दैट पेशेंट कि हाँ ठीक है, आप ये टेस्ट करा के फिर सीताराम में आ सकते हैं, आपकी कंसल्टेशन में बुक कर दी है। मैम किसके बाद अगर पेशेंट, मतलब ये तो तब हमारा सिनेरियो है जब पेशेंट ऑलरेडी IVF साइकिल अवेल कर चुका है या फिर उसको IVF की नॉलेज है। बट इन केस अगर पेशेंट को खुद ही नहीं पता दैट दे आर ट्राइंग फ्रॉम लास्ट 2 और 2.5 years, दे आर ट्राइंग नेचुरली बट दे आर नॉट कंसीविंग, बट अभी उनको कुछ नहीं पता, दे आर वेरी रॉ दैट दे डोंट नो व्हाट एग्जैक्टली हैव टू बी डन विद अस। बट उनका सबसे पहला क्वेश्चन आता है कि खर्चा कितना आ जाएगा, मतलब बिकॉज दे डोंट नो एनीथिंग, बिकॉज दे डोंट नो कि ये साइकिल होती है या उससे पहले कोई प्रोसीजर होता है या क्या इंजेक्शन लगते हैं, उनको कुछ नहीं पता। बस उन्होंने उड़ी उड़ी खबरें सुनी होती हैं ऑल ओवर द मार्केट कि हाँ वो 2 लाख रुपए मांग रहे हैं, वो 3 लाख रुपए मांग रहे हैं, वो लोग इतना मांग रहे हैं। तो इस टाइम पे पेशेंट को काउंसलिंग अगर हम करना चाहें हमारी CRM टीम, तो वो किस तरह से कर सकती है कि हम पैसे ना भी बताएं फिर भी पेशेंट को एटलीस्ट इतना समझ में आए कि जिनसे हम बात कर रहे हैं वो हमें बिल्कुल जेन्युइन नॉलेज दे रहे हैं। क्योंकि ये तो बात सच है कि कंसल्टेशन के बाद ही ये डिसाइड होगा कि उनका एग्जैक्टली होना क्या है, बट आप तक पहुंचाने के लिए उस पेशेंट को क्या बोलना है मैं वो समझना चाहता हूँ।
Okay, this very practical question, Ashwarya. So whenever a patient comes without, a zero slate, clean slate, right, and then we have to guide him, then we have to guide them very, very comfortably first, and we have to be very, very transparent with them, and let the patient decide what she wants, right? So, or an encounter with any of like Dr. Nikita Sharma and Dr. Venika Bansal, right? So that time you have to simply ask the patient the basic profile, age and all that. Because in Sitaram Bharti, we don't want to give, any particular kind of that this much dose of injection to everyone. So in Sitaram Bharti, we are very, very have very individualistic approach for the patient. Patient who are less in age, right? They always need little bit, doses of injection as compared to little bit low doses of injection as compared to advanced patient. So if the patient age is low, right, you can simply tell them that it may be cost around 1.5 to 1.6. And now there's a two kind of cost involved. Number one cost is the cost patient is paying to the hospital. And the number two kind of cost is about the medicine when they're coming and going and consultation, all those things. But patients generally have this very, they kind of sort of calculate everything as a sum that this much is going to spend. So yes, if I'm able to answer you, Aishwarya, this is what your query was.
Yes, ma'am. So basically, we need to ask their age. We need to ask their locality where they are located, so that we can get idea कि इस पेशेंट को कितनी बार हम हॉस्पिटल बुला सकते हैं फ्रिक्वेंटली, कितना इजी रहेगा पेशेंट के लिए हमारे पास आना, और कितना इजी रहेगा पेशेंट के लिए अपना एक्सपेंडिचर डिसाइड करना कि हाँ अगर मैं सीताराम भारती चूज़ करता हूँ तो मुझे कितना खर्चा आ जाएगा। जो आपका सेकंड पार्ट था कि हाँ मेरा आने जाने का खर्चा है, वहाँ स्टे का खर्चा है या किसी रिलेटिव के घर रुकना है, तो वो डिसाइड कर सकते हैं। तो हमारी CRM टीम एटलीस्ट उनसे एज और उनकी ये डिटेल्स तो पूछ ले ग्राफिकली कि वो कहाँ लोकेटेड है और वो कितना ईजी है उनके लिए आना जाना, जस्ट टू गिव देम एन आइडिया कि सर आपका अगर IVF होता भी है, सो यू हैव टू टेक आउट एटलीस्ट 15 to 20 days फॉर योर प्रोसीजर।